quickly have a recap of what we did in the last class. Especially Dr. Vabhiba was not there, so maybe it will help her to get the idea what exactly we discussed.
Yes, thank you so much. Yes, that would be great.
So if you remember what we discussed last time, it would be nice. We don't remember? So maybe just 1.1% can say, and then we can, that we have recap from everyone. 1 point. Yes, sir. Please go ahead, Dr. Ravi, please.
The workshop was predominantly focused on how the doctors should interact with the patients. Initially, there were examples shown of how the doctor did not greet the patient properly. It was very, casual and very rough in manner. So the discussion was based on not only the content, what we speak to the patient, our body language, our facial expression to show empathy to the patient, and the whole talk was around that.
Thank you. I think you have given us a bird's eye view. I think we primarily focused on our verbal and non-verbal communication. And although we saw the videos about the doctor-patient communication, but I think that can be generalized to any setting. It could be the front desk staff, it could be the nursing staff, it could be anybody interacting with patient, or even between us, between healthcare professionals when we interact. I think more or less we interact in the same manner where we are not very careful about words. Words still we may think and speak, but then when it comes to the tone of voice and the other paralanguage, we are not very conscious of that. And also we saw the body language part, and we discussed at length about the, facial expressions, eye contact, the way we sit, the way we stand, and the hand movements we make. Even touch and time part also was discussed, that how important it is to value patients' time, because they feel bad when we don't value their time. So all this was discussed at length. I'm sure some of you must have gone back and seen the video, the YouTube recording, because that's a good way to recap. So continuing with that, we are going to spend, say, around half an hour on two aspects that are left from communication that we need to cover. And then we will move on to the third topic of the discussion, and that is how do you go about designing a successful program. So quickly about the communication part that we are still left with. If you remember, we talked about listening as an important part of communication. Some of you had actually pointed out that listening is a very important part of communication, and I completely agree with you. So actually, communication is incomplete without listening. Normally, we think if I'm able to speak well, I'm communicating well. But the thumb rule says 80% listening and 20% talking. And we all know how much of listening we actually do when it comes to patients or their family member. We like to do most of the talking. We like to explain, we like to talk, but we don't ask the patient, what do you want, or what do you think, or what do you want to say? And that's the major problem where a lot of time the communication gap happens when we don't allow the patient to speak. Similarly, a lot of us think that I am listening and I'm actively listening, but very honestly, sometimes we don't register a lot of important information also. And that also gets lost in the process. So we'll do a small activity. I'm really not sure where are others. Either they have not realized that we are meeting today or what it is. We are just 8 of us. But never mind, I think we'll go ahead with the session. So I'm going to put 5 of you in the waiting area for a couple of minutes, and I will be bringing you back one by one. So I hope that's okay. I think there is electricity failure, I believe, on Dr. Ravi's side. Dr. Ravi. Dr. Ravi, are you there? Can you? I think he's lost even the network because of the electricity failure. So I'll just put 4 of you. Is that okay? If I put
I'm there, ma'am.
okay, great. Thank you.
It comes back on cellular, but just at the light.
Okay.
Yeah.
Okay. So I'm going to put 5 of you in the waiting room and bring back one by one. So I'm not choosing anybody, but I'm going random as per the the names that are coming in order. So Dr. Ravi Matani, your names come first. So I'm going to put you in the waiting room. Okay. And then next is Dr. Farha.
Okay, ma'am.
Okay, you're going to the waiting room. Then I'm going to send Dr. Nair, Dr. Rajesh Nair. I'm putting you in the waiting room. 3 people gone, and then Dr. Janvi. Yeah, Dr. Janvi, you are going to the waiting room, and one more person, Dr. Sudarshan. So I'm going to put 5 of you in the waiting room. Okay. So I'm going to share a screen with you. So I think I'll give the responsibility to Deepika to read that screen, although everybody will be able to see and everybody will be able to read the content. But Deepika, you will be reading the content, and then in your own words, you have to say whatever you understand from that screen to the next person whom I admit from the waiting room. So Padma, we have just started with the activity. It's about the communication part, how we communicate, and what happens in the communication. So those of you who are there with me, you will have to just observe what is happening, and then after the activity, like we will discuss what exactly happened in the activity. So give me 1 second to show you the screen. Yeah. So we have just 4 people in the waiting. No problem. Okay. So there we go. So Mr. Hashim, we have just started with an activity. You have to just observe what is happening, and then we will discuss what exactly happened in the video. So Deepika, this is the slide for you. Read it, and others also can see this slide. Others can read this slide, but Deepika will be participating. Others will be observers. So Deepika, when you are ready, just let me know that I'm ready, and then I will start sharing it. Yeah. So it's okay. Take this activity like normally we listen, and we don't. You don't have to get into it very soon. So I hope you have been able to read the content. Okay. So I'm going to stop sharing the screen, and now I will admit people waiting in the waiting area one by one. So I will take in Dr. Ravi Matani. So whatever you have understood, you have to explain to him in your words. So let him come in, and then I will just uh, inform him what about the activity, and then you can start. So Dr. Ravi, can you hear me?
Yes, ma'am.
Okay, so can you please have your camera on?
Oh, sorry.
Okay. So Deepika is going to share a set of information with you. So kindly listen to her carefully. So Deepika, please go ahead and share your information with Dr. Ravi.
Hi, Dr. Ravi. So I'll be giving you a few facts about a patient called Ram, who is being affected with pulmonary tuberculosis. And he is a quite elderly person of an age about 65 years old. And he has been staying in the ICU for the last 5 days. And it has costed him definitely a huge amount of money, which is about 5 lakh rupees. So he's in a bit critical stage, and he's also a bit, really worried about his recovery. Actually, his son, who is the only breadwinner of the family, would like to meet the doctor in order to consult about his father's recovery and the treatment process. So these were the few facts which were there in that slide.
So thank you, Deepika. Dr. Ravi, I'm going to admit Janvi, and whatever you have understood, you have to explain in your words to Janvi. Is that okay?
Yes, ma'am.
Okay. So I'm taking in Janvi. Let me just explain to Janvi what he's supposed to be doing, and then you can share the information. So Dr. Janvi, Dr. Ravi is going to share a set of information with you. Listen to him carefully.
Yeah.
Yeah. So Dr. Ravi, please go ahead.
Good evening, ma'am. I am going to share some information with you about a patient who is admitted in the ICU. His name is Mr. Ram. He is age 65 years. He has been admitted for the past 5 days, and his condition is a little critical. His son would like to meet up with the doctor to just discuss about the prognosis, and they are a little concerned about the cost also. Thank you.
Thank you. So Dr. Janvi, I'm going to add Dr. Rajesh Nair, and whatever you have understood, you have to explain in your words to him. So let him just come in. Let me explain to him what the activity is, and then you can start.
I'll call you back.
So, Dr. Rajesh, so can you please have your camera on?
Yes, ma'am.
Yeah.
Yes, ma'am.
So Dr. Janvi has a set of information she's going to share with you. Please listen
Yes,
to
ma'am.
her carefully. Yes, Dr. Janvi.
Yes, ma'am.
Please go ahead.
Hello, Dr. Rajesh.
Yes,
I
ma'am.
wanted to discuss a case with you. This is about Mr. Ram, who's a 65-year-old male, and he's admitted in the ICU, and he is quite critical. And the family wants to know more about his prognosis and clinical condition.
Okay.
Thank you. Thank you.
I don't know. Okay.
That's all right. That's all right. That's perfectly all right. So, Dr. Nair, I'm going to add Dr. Farha. So, whatever you have understood, now you need to explain in your words to Dr. Farha. So, let her come
Okay.
in. Yeah. So, and then you can explain in your words. So, Dr. Farha, Dr. Rajesh has a set of information he's going to share with you. Please listen to him carefully. Go ahead, sir, please.
Dr. Farah, good evening. I'm Dr. Nair. I wanted to discuss you about a critical patient who's a 65-year-old male admitted in ICU.
Sir, I can't hear you properly.
Dr. Nair, I think there was some network issue on your side. Can you please repeat?
Yes, that is-
Yeah. Can you please repeat?
Good evening.
So maybe-
Dr. Nair speaking.
Dr. Nair, can you switch off your video while you are speaking? Maybe the quality of audio might improve.
Good evening, Dr. Farah. Am I audible?
Yes, yes.
Dr. Farah, I wanted to discuss with you about a patient. The patient is a 65-year-old male who's admitted in the ICU in a critical condition.
Okay.
No,
Yes.
that's the information I have.
Okay. Thank you. So, Dr. Farah, I'm going to add Dr. Sudarshan Joshi. So, whatever you have understood, you have to explain in your words to Dr. Joshi. So, let him come in and let me explain to him what the activity is. So, Dr. Joshi, Dr. Farah has a set of information she's going to share with you. Please listen to her carefully. Dr. Farah, please go ahead.
Dr. Joshi, I want to inform you about a patient. He's 65 years old and he is admitted in the ICU department.
That's all, Farah?
I would like to ask him if he has listened it or not. Could you please tell me what you have heard? Dr. Joshi?
Yeah.
Yes, please tell me what you have heard.
There is a 65-year-old patient admitted in ICU.
Okay, thank you.
That's all?
Yes, ma'am.
That's all?
That's what I heard.
That's fine. That's fine. So Farah, what do you, Dr. Sudarshan, what do you ultimately get from this communication?
Okay. It's just about a patient admitted in ICU, whether male, female, with what problems.
So what will you do with this information? See, we normally think it's patients who mess up with the information. They don't communicate well. Imagine we are all professionals from healthcare. And the information that I shared was very, very simple. But see the human tendency to mess up. Those who were observing, what did you observe? I will show this slide to everyone in a minute. But before that, I want to know from all of you, if you would like to write in the chat box and tell me, what did you observe? What happened to the message? What happened to the information?
I guess there was an intense loss of information that happened, especially the critical parts such as the age of the patient, the disease, the cost that was incurred, and the family's concerns. So I think most of the important aspect of the communication was missed out. I mean, that's quite scary to see, as it is like filtered at every stage. I mean, that really made me feel, oh my God, Yeah.
See, such a simple activity, I think, must have made it very clear to you when the message goes through so many people, how it can get distorted. I think that's one of the huge learning from it. So that means if it's something very important, it's always better to communicate directly with the person. And also, all of you were listening. All of you were not like distracted or you were not interested. You were keenly listening. But in spite of that, imagine the human mind game, how it takes away your attention, how it gives you a different meaning, how you change the interpretation, how you add something that you want. I have noted down. For example, Deepika tried to explain, and rather she explained much more than what the information was, so that the next person gets the information. Okay, Dr. Ravi Matani also tried remembering the name part, the age part, even the cost part. He did try to communicate. But then down the line, the whole information slowly got truncated, and what was left was actually meaningless. What Dr. Sudarshan got to hear was that there's a patient, 65 years old male, in the ICU. That's all. Am I right, Dr. Joshi?
I think I didn't even hear about male or female, just a 65-year-old patient admitted in ICU.
And what do I do with that information? Now imagine when we communicate about a patient, about a treatment, about a referral. In last class, I remember we had an advocate, and he is dealing with healthcare, cases. He brought in this case that a patient had a surgery and he needed a neurologist intervention immediately because he experienced numbness over his chest. And when the cardiothoracic surgeon was approached, he said, call the neurologist, ask him to do the intervention. But the message got so messed up that the neurologist came the next day after 16 hours. The whole intervention just got missed, and the patient became he went into paralysis, and then the hospital had to pay a huge penalty for the error. I think this small exercise explains us so well that how important it is to make sure that you Padma, your mic is on. Can you please mute your device? I request everyone to keep your device on the mute mode. Unmute when you speak, and then please go back to mute mode. Unless you're sitting in a very silent room when there's nobody around you. Okay, so you can imagine what happened. Somebody added the information, somebody changed the information, somebody removed a part of information which he or she thought that it is not important, not essential, and we lost the information in that process. Active listening. Now, how could have this whole thing be avoided? How could this loss be avoided? Can you think of some reasons? Put in the chat box. What all could be done to avoid missing this information or losing this information?
To use standardized formats to communicate, or
Wonderful.
sometimes even cognitive aids,
Yeah.
such as I pass the baton,
Yeah.
which has,
Yeah.
these are mnemonics, which can help us stay on track as we communicate.
So, Dr. Verbibi, all those communication tools that you're talking about, of course, we normally use. I mean, in most of the hospitals, we use them as a way of handing over the patient. But in our day-to-day communication, I mean, I don't think we follow any protocol. But can we be careful to make sure that at least some information is exactly understood or communicated? For example, I can see some good answers like Janvi has written, writing it down. Yes. Had we written on a piece of paper whatever Deepika was saying, if Dr. Ravi had noted, and then when Dr. Ravi was speaking, the next person would have noted, we could have actually, made sure that most of the information gets, communicated. Yes, should jot down salient point. I agree with you, Dr. Ravi. Writing it down. Again, see, many of you are saying writing it down. Can confirm some fact. Yes. Again, whatever you say, like for example, Farha in the last tried asking Dr. Sudarshan, can you tell me what have you understood? That's such an excellent tool. But since there was not much that Farah had communicated to Dr. Sudarshan, so he had not, understood much. But whatever he understood, he did try to repeat it. Yes, I think Dr. Haq has very rightly said, write down and reconfirm. Even Dr. Sudarshan Joshi has written, write down, confirm with the person to whom your information. Take sign. Yes, of course, if it's a very critical information which needs to be, legally kind of endorsed that yes, it's communicated and noted, then you have to sign and also get it signed. Asking questions to get, yes, Dr. Farah, I think that's another beautiful input coming from you. If the person who is listening could ask some questions, even that could have brought in more clarity. Like, for example, when the first person communicated to the second one, if second one did not understand anything, he or she could have asked, what do I do with this information? What have I to do with this? What do you want me to do with this information? I think more clarity could have come if you had asked questions about it. Absolutely, I think. And record it if long, important counseling. Yes, and especially certain communication needs to be, recorded for our own safety, for also as a legal evidence, especially when you're prognosticating the family, when you're telling them about the patient's condition, or you're updating them, or you're breaking bad news, or any communication which is very vital and sensitive. Of course, that should be. But we are talking about even day-to-day communication. How do you make sure, especially when the language, vocabulary, academic, qualification of the person is very different. For example, if you're talking to a technician, maybe the terminology you're using is not understood by your technician. There can be loss of information. You're talking to a patient who's completely a lay person. Again, there can be huge loss of information just because your qualification, your professional background is very different from patient's understanding. Definitely, your patient will not understand. So all those things, like we discussed in the last session also, you got to see the patient's background, patient's, qualification. Does the patient really understand? So let me quickly show you the slide that I had shown to Deepika, to the first participant, and those who were observing. This will give you an idea what was the information. And Dr. Sudarshan must be wondering, what did I get to hear? So I think one important thing that we learn from this activity is when we communicate, both the parties have equal responsibility. If you can get this message through this activity, I think most of the things will be looked after. We normally think the person who is speaking, it is his or her responsibility to explain in a manner that I can understand. But that's half the job. The person who is listening, it is also the responsibility of the person who is listening and taking the message to ask questions, to clarify, to check what exactly the sender wants to say. And you can actually make sure that both the parties are on the same page. The whole communication error could have been avoided. Now, if I may ask you, how will you demonstrate, especially when you're talking to your patients, how will you demonstrate that you are listening to him or her? And even with your staff, if they're talking to you, how will you demonstrate that, yes, I'm listening to you? Because it's not just listening, but it's important also to demonstrate that, yes, I'm listening, because patients sometimes feel that I was not heard, or the doctor did not take my problem seriously. He or she did not listen to my problem seriously. So how will you demonstrate? Write in the chat box what thoughts come to your mind. How will you demonstrate? Are you able to think of some answers? You are listening to me. You are actively listening to me. So what are you doing to demonstrate that you are listening to me? So when you are interacting with the person, one of the best ways to demonstrate and also listen is face the person. When you look at the person gets the feeling that, yes, I'm being heard. Make adequate eye contact. When you make eye contact, the person gets to know, yes, he or she is being heard. If appropriate, smile. I think last time also we discussed that we don't smile, we keep a poker-like face. Patients sometimes get confused. Am I being heard? Am I being understood? Is the doctor agreeing with me? Is he annoyed? Is she not agreeing with me? So, if possible, if it is appropriate, smile so that the person gets to get this confirmation that, yes, I'm being heard and accepted. Also, at times, we simultaneously start doing things like attending a phone call or making a note, or maybe start working on computer. Multitasking is going to confuse the person that I'm not being heard. So put things on hold so that the person gets a feeling that I am being given 100% attention. Like we discussed in the last class, your posture plays a big role. When you make eye contact, when you nod, the person gets the feeling that I'm being heard, I'm being understood, and the person who's listening to me is agreeing. Also, when the person is speaking, it's not a good idea to interrupt, because when you interrupt, the person can suddenly lose the track of what the person was saying, and also may become upset or get disturbed or get complete thought block. So good idea is to note down the important points, and in case if you need to ask something to clarify, you can ask them after the person has finished. So the whole idea is that if you practice these skills, these are just basic 5-10 skills, and if we bring in our communication, I think the person gets an idea that he or she is being heard. It could be with your staff, it could be with the patient or their family member. Now, in this slide, I've shown you 10 listening practices that we all do. So count the number of yes, whatever your answers are, count the number of yes, and then write in the chat box if you practice this way of listening to your patients, or anybody for that matter, patients or staff or patient family member, whoever. Yeah. So just count the number of yes for yourself. And write in the chat box your answer. So how many yes for you? Please write down. Count the number of yes for you and write down in the chat box. Don't spend much time. It's just 10 statements, yes and no. That's all. Hesitating to write?
Ma'am, I think pretty much all of us have responded. Maybe our messages are not coming to you because for the last question also we did respond.
Oh my goodness. No, I could not see any. Oh, now I can see. Thank you. Thank you for letting me know. I'm so sorry. I couldn't get any notification that you have already. Okay. So Janvi says 5, Ryan says 5, Dr. Ravi says 5, Deepika says 4, Dr. Farha says 3, not to all, no to all. Okay. That's great. Dr. Vyadu says 6, then Rashmi says 4, Dr. Nair says none, Dr. Sudarshan Joshi says none, then Padma says 4, Dr. Haq says 2, Mr. Hashim says 4, and Dr. Sudarshan Joshi says 2. Wow. So we are ranging somewhere from 6 to 1. You know now what is not okay. According to the number of yes that you have given, they are supposed to be no. So work on yourself and make sure that you are able to improve your listening habit, because we normally think I'm a good listener. But I think you saw in this activity how good listener we are. And I mean, we should really open our mind to the idea that we think I'm listening well, but we get distracted, or we are in, somewhere else, or not really registering very well. So that was about active listening. Another important part of, communication is confirming whether the other person has really understood. Like some of you just mentioned about the idea of asking, have you understood? Or checking, have you understood? A lot of time we think what I'm saying is so simple, so easy to understand, anybody can understand. I don't think I need to, really confirm whether the person has understood or not. But trust me, a lot of time what you say may be perceived very differently by others. So let's do another small activity. I hope all of you have a copy and a pen with you. Okay, so I'm going to give you a set of instructions, and you have to draw according to those instructions. So in case if you don't have a copy and a pen, you can, pick up a copy and a pen for you, because we need to draw. So everybody ready? So another, you can say, message that I wanted to give to all of you. Please, during this session, look after yourself. You can take tea, coffee, juice. I mean, I know you have come back after a long day, so there's absolutely no problem. Keep yourself well nourished. So you can take tea, coffee. I normally keep taking something because continuously when you speak, you feel thirsty and tired. So I request all of you to look after yourself. Okay, so I'm going to give you a set of instruction, and you need to draw according to those instructions. So we are going to draw a bug. We're going to draw a bug. The bug is round. The bug has 8 legs in pairs, 4 legs on the left and 4 on the right. In the pair, one leg is longer than the other. The bug has feelers on the front of the longer leg. The bug has pea-pod shaped wings. Should I repeat? The bug has pea-pod shaped wings. Pea-pod. मटर का pea pod. मटर का दाना होता है ना, मटर का छिलका. Peas. Clear? Is it clear to everyone? Okay. Then the bug has a stinger coming from the bottom of its body. Sorry, Padma, you want to ask something? Unmute your devices.
Please repeat, ma'am.
Okay. The bug has a stinger coming from the bottom of its body.
Only one.
One is enough to sting.
Okay.
The bug has two eyes placed on both sides of the face. The bug has a round mouth placed between the two eyes. And the last one, the bug has laid 5 square eggs on the right side of the stinger. Should I repeat?
Last one, ma'am. I couldn't hear last one.
Sure, I will repeat. The bug has laid 5 square eggs on the right side of the stinger. Done, everybody? So I can see some people are there, but they have not put on their camera. Can I request everyone to have your cameras on? And humble request to all of you to keep your cameras on, because if you're not visible to me, I'm not connected with you. Then it's your loss and my loss as well. So request you to sit at a place where you can have your camera on and keep it on. Keep it on. For a minute or so, if you switch off, it's okay. But in general, please keep your cameras on. Okay. So I hope everybody's drawing is identical. Let's see. So put your drawing in front of the camera. Bring it closer to the camera and let's see. Is everybody's drawing? Wow, some of you have really drawn beautiful. रेहान आपका कहाँ है? करा कि नहीं करा? नहीं करा रेहान? देखा ऐसे पकड़ लेती हूँ मैं. Okay, great. आशन जी आपका कहाँ है? Where is yours? Have you drawn? Wow. But why isn't your drawing identical? Dr. Kapoor, आपकी सबसे बड़ी है drawing. Why is it not identical? Wow. Dr. Ravi की भी बहुत सुंदर है. एक जैसी क्यों नहीं है? Why is it not same?
Perception is different. Each one's perception is different. We perceive different things in different ways.
Absolutely. So when we speak to our patients, for example, a patient has come for tympanic membrane repair, and you say this surgery has 90% success rate. Or for example, we have an eye specialist. So let's take an example from ophthalmology. There's a patient with retinal detachment, and you say this surgery has 90% success rate. What could be the different interpretations the patients might have? Try your hands, all of you. Yes, different interpretation of information, absolutely. Perception different. So what could be the different meanings you think the patient will derive out of this statement that your surgery has 90% success rate? Oh, it will be surely be a success. Yes, somebody might think it will be surely be a success. Even Deepika says very successful surgery. Okay. What do others say? 90% he will feel that he will recover fully, full vision. Yes. It has a chance of failure. Yes. You will see some patients knowing 10% is a huge number. 10% is actually not a small number. It's a huge number. So for some patients, 10% can be a very, very big number. Or like Dr. Janvi says, the doctor is very confident, therefore he's saying 90% success rate. Or the doctor, or the chances of failure is less. So somebody might see 10% failure is not very big thing. It's very less. But somebody might say, oh, 10% is a huge number. That means out of all 10 patients, at least one patient will not have full vision. Or like Dr. Huck says, the patient may be confused and may say, why doctor is not confident. Dr. Kapoor says, as layman, oh, it's a sad news. See, imagine, now all of us are trying to get the meaning out of it. Patient might think, for example, for a tympanic membrane repair, the patient might think, okay, my 90% of the hole will be repaired. I will still be left with 10% of the hole. Somebody might think my 90% of the hearing will come back. 10% I will still not be able to get back. So Dr. Janvi says the patient will say, better take a second opinion. So that's the problem. When we say something, we know the meaning that we have within us. We really need to check what is the meaning the patient is going back with. A lot of time, patients do not get exact meaning. So what happens? Okay, Deepika says it's a safe answer. From whose point of view? From patient's or doctor's point of view, Deepika?
The patient might think that, the doctor is giving a very safe answer and he's
But
not
then,
very...
Yeah, but then at the same time, if the patient thinks 10% is a huge number, it's not a safe answer. It's a very, very, So what I'm trying to say, the idea is there is a possibility what you're saying and what the other person is understanding is very different. Now, but the activity that we did in the beginning, where the message was that there is a patient, and very simple message, absolutely simple message, that there is a patient in ICU, 65 years old, suffering with tuberculosis, admitted for the last 5 days, spent almost like 5 lakh rupees. Family is concerned about the recovery and the prognosis, and they want to meet the doctor. And especially because they have spent a lot of money, so the son wants to know the future plan of action. I mean, had this whole message been communicated in some or the other words, at least the message would have been complete. But we saw the message getting truncated. We saw the message getting completely distorted. And at the end, there was no message at all. Yes, Dr. Kapoor says, I'm spending money. I want 100% result. Yes, you will have patients who will say nothing doing, 90% is not enough success rate. I need to get 100%. They want 200% assurance from us. Guarantee दीजिए. Normally they say, no, guarantee दीजिए कि बिल्कुल ठीक होगा. मैं पैसे खर्च कर रहा हूँ, आप मुझे guarantee दीजिए. So these are the common, so it's very important to make sure that has the other person really understood what we are saying. So check the other person's perception, and you will get to see lot of time there's lot of communication gap. So there's a technique called teach back technique. Teach back technique is, this is what I said to you. Can you tell me in your words what have you understood? Especially when you are giving some vital information, especially when you are breaking bad news, especially when you are updating, especially when you are writing discharge summary to your patient and letting them go. Now they are no more under your care. They are going to go home and continue their treatment. There can be huge error just because what you said and what the other person has understood could be very, very different. So teach back is a technique that can help us make sure that the person has actually understood. Now, two deciding factors that decide the quality of our communication. One is our attitude. We all know wherever we have positive attitude, our style of communication differs. We become willing to engage in conversation. We become interested in answering the questions. The problem is with patients, with people with whom we are not very comfortable. Normally we don't have a positive attitude. So we need to really check, is my attitude towards my work, my profession, my organization, my patient, society on the whole, is it positive or not? And you will see people who have negative attitude towards any of this, they will not engage into conversation. The second important thing that goes, in making our communication very, very impactful, that's empathy. Because that's the way you actually communicate. Yes, I understand your suffering, and I will try my level best to reduce your suffering. When you practice empathy in real sense, you actually understand their world. You try to look at their world from their point of view. So you will not judge them. You will not label them even when they are aggressive or they are misbehaved, because you will understand that this misbehavior is coming out because the person is stressed out or is anxious or is worried about the recovery. That's why the patient is becoming aggressive or angry. So when you will understand feeling, definitely your way of communication will be more to kind of, calm down the person or help the person see the reality and, tone down the expectations of the person. My question to you is, what are the barriers in expressing empathy? What are the barriers in expressing empathy? Because we see a lot of time we are not, very empathic. Do you agree with me? We do our work. I'm not saying that if we are not empathic, we are not careful or we are not responsible. We are very responsible. We do our work. But when it comes to expressing empathy, we have challenge. We normally avoid. Okay, I have an answer coming from Janvi. She says difficulty in understanding the emotion. Absolutely. A lot of time we don't know what is the emotion. And then we don't know how to handle it also. Dr. Farha says we feel unsafe and insecure. Because Farha, can you explain this? Because I can see this is coming from your experience. So on what exactly you mean when you say this, we feel unsafe and insecure? In handling emotions or expressing emotions?
Ma'am, I think in handling emotions.
Absolutely. Absolutely. Because we think that I will not be able to handle the emotions, especially if they take an extreme form. If the person who is trying to, raise the voice can suddenly become aggressive, probably I will not be able to handle. Or the person who is looking sad, and if I try to explore the emotions, the person may suddenly start crying or may suddenly start yelling. I don't know how to handle. Absolutely right. We don't know how to handle these emotions. So we always stay a step. We keep a step, hands distance, so that we don't get into that kind of a interaction with the patient. I agree what you're saying. Yes, Dr. Webavi, I completely agree with you. We focus on clinical care only, because handling emotions means actually giving holistic care to the patient. We are not used to that. We are not trained to do that. We find either we don't know, or we find short of time, or we normally say we are overworked and overburdened, so that's not something I need to do. But the thing is, we all know a lot of practitioners who actually practice empathy and who really connect well. They are really successful in their practice. Dr. Ravi Matani says time constraint. Often the patient goes on, and what we feel is very trivial. So what we think is very trivial could be very important to the patient. I can recollect one case. This patient was, somebody's mic is on. If you can please mute your device. Thank you. Thank you. So I still remember a case. This patient was referred to my husband from a relative of ours who needed, surgery. So she said that this is my sister. She needs cataract surgery. And 3-4 times she has gone to the hospital, got admitted. But the day she needs to be operated, she has to undergo surgery, she'll run away from the hospital because she's very scared of, the surgery and also anesthesia and going to the OT. Now, for us, it might be, what silly. What is this? Is such a small thing, and why is she acting like this? But for her, it could be a very huge problem. So it's not us, but it is the patient whose needs have to be, addressed. So therefore, we are moving now from the doctor-centered practice to the patient-centered practice, where we are trying to look at things from the patient's point of view. We are going to talk about this topic in the coming sessions, and you will understand why it is important to now look at things from the patient point of view. Yes, Shivraj, I agree with you. Objectification is another reason where we actually, we just think that that's required, this is not required. This is essential, this is non-essential. And therefore, we just do not address it. There are many more reasons. We don't know the difference between empathy and sympathy. A lot of us think if I empathize with the patient, I'll be attaching myself. So I'm going to be burdened with the emotions. My life is going to be affected, especially people who are in critical care. There you are dealing with critical conditions and death and poor prognosis. So you feel if I attach myself with the patient, I'm going to actually get burdened with the emotions and my personal life is going to get affected. Empathy does not require you to attach yourself. Empathy is, yes, I can understand. I'm there to help you. I shall give my best to help you. And then you end it there. It is sympathy where you cry with the person. You don't go home and you don't take your food, or when you're not able to fall asleep because your patient is serious. That's not empathy. That's sympathy. So I have two beautiful slides to share with you where you will see the difference between empathy and sympathy. And I think that will greatly help you in understanding the difference. Empathy is not spontaneous. You will have to learn it. It doesn't come automatically. Sympathy is spontaneous. When you watch a TV show where there is some death or some grief, you automatically start crying because it's spontaneous, it's emotional. Whereas empathy is not emotional, it is intellectual. Empathy is advanced, whereas sympathy is primitive. Even small kids cry because even they don't understand. If they see somebody crying, they'll start crying. Empathy is effortful to start with, but once you start practicing, it's effortless. But sympathy is effortless to start with itself. There's no effort made. Crying does not require any effort. Rather, you cry and then you try to control, okay, I don't have to cry here. Empathy requires understanding. Sympathy requires feelings. In empathy, you have good control on your feelings. Empathy is altruistic, whereas sympathy is egoistic. Empathy is a cognitive behavior, whereas sympathy is an affective behavior because it is actually creating emotions and expressing emotions. Empathy actually creates separateness. You know your role. You don't forget your responsibility. You clearly know I'm here to help. I'm here to see what I can do, for the patient. So, for example, if there's a person who is actually drowning, in empathy, you will not jump into the water to save the person. You will stay on the bank. You will see how can I save this person. You will try to look for something that you can offer to the person who is drowning to take that person out. But in sympathy, you will actually jump into the situation, thinking that maybe I can save. There's a possibility the person might die and you may also get drowned with that. Again, as I said, empathy is a learned behavior. Sympathy is innate and you don't have to learn it. Empathy actually comes from neocortex. Sympathy is a limbic system action. Empathy is parasympathetic, sympathy is sympathetic. Empathy is inhibitory, which actually gives you a lot of control, whereas sympathy is excitatory. Empathy saves your energy because you are consuming your energy in the right direction. So it's very empowering. It's rather energy giving. Whereas sympathy is energy consuming. At the end of the day, you're going to feel, exhausted in that process. And people who practice empathy, actually, they enjoy professional satisfaction. Whereas in sympathy, you actually experience burnout because you are giving energy. 6 ways to practice empathy. When the person is talking, a lot of time you can't do anything, but you can listen. If you can't listen, have somebody in your place who can actually lend an ear. A lot of time, if you just listen to the patient, that also gives relief to your patient. Then we have a tendency to judge the person. ये ज़्यादा बोलती है, ये कम बोलती है, ये सुन ही नहीं रही है, ये कैसी बात कर रही है. We have a tendency to judge people. Avoid. If you can withhold judgment, you will actually be able to empathize. Then try to be understanding. by looking at the situation from the other person's perspective. So you are trying to come in on the same page your patient is. Show empathy through your body language. So check your body language. Anywhere if the body language is indicating you are not listening, you are not interested, you are tired and you are upset and you are frustrated, your body language is not empathy. Then proactive, mindful. That means you are at the same time thinking, what do I need to do? What is my role? How can I relieve this suffering? And for that, you ask more questions, ask open-ended questions where you get to understand what is the problem and what the patient really needs as a help. I think disease and death, they're very scary. I didn't know that. I only got to realize it when I lost some of my dear ones. I don't wish anything of that sort to anybody, but at the same time, I know that communication, empathy, attitude plays a huge role in healthcare. Let's not keep it mechanical. Let's not make it mechanical. I know when we are doing something every day, it becomes more like a daily routine. But the patient who has come to you, they have come probably the first time, or maybe they don't come. I mean, the same patient does not come every day. Their suffering, their pain, if we can understand and make sure that we can, at least through a good behavior, if we can reduce their suffering, that can be a great service to the profession, I would say. So this is in a nutshell about the topic that we started in the last class, but a part of it was left. I have a video to show, but I will not be showing it here because again, we'll be losing time on that. But I'll show this video anytime whenever we'll have 10 minutes time. It's a video on empathy. Many of you may have already seen this video. This is a video produced by Cleveland Clinic, Ohio. I mean, I haven't seen any better video on this topic of empathy. I'll be showing you in one of these days. Any questions about what we have discussed till now?
Ma'am, I have a question.
Please go ahead. Yeah.
Ma'am, sympathy is egoistic. Why is that?
So sympathy in if I say in Hindi, किसी पे दया करना. When we pity on somebody, we somewhere have this feeling, I'm great. Oh, how nice I am. I'm pitying this person. So when you feel sympathetic or when you express empathy, I'll give you a difference. Sympathy is feeling for the person. So when you're feeling for the person, in a way, you are pitying that person by saying, oh, this person is suffering, poor fellow. See, he can't even afford. He doesn't have anybody to look after. So when you're saying this, it's actually serving your ego. I'm better than this. I can do this. I can afford this. That's the difference. Thank you. Thank you for asking that question. That means you were really trying to understand every word. Every word. Thank you. Any other question? So in these two sessions, that session 2 and whatever we have covered now, I just tried to give you a bird's eye view about the effective communication skills that we all need to practice, not just with patients, but with everybody with whom we interact. Yes, Dr. Jaipur, I think you are just spot on. When we take people as unequal, we kind of, express sympathy by showing I'm more than. Absolutely, I completely agree. Absolutely. Any other question, if anybody has, before we move on to the next topic?
I really want to bring in the point of compassion also over here.
Absolutely. Go ahead, please.
So definitely some of the times when the patients are coming to us with the repeated visits and we keep on expressing empathy, somehow I've seen that patients realizes that these are mere words. Somehow we need to now move forward to the compassion also. And there's a difference between empathy and compassion, which we really need to work upon the compassion also. It's just not your words. Yeah. Somehow we always say that you should show also that you are doing your best to help him out. It's just not your word should be there. Like we always say is that what matters ultimately is that patient should realize Dr. is not only being empathetic, he's trying his best to help me out also. Whatever
So
is my
empathy,
limitations
absolutely,
within
yeah.
those limitations.
So empathy is not just verbal, lip service. It should actually get you through your actions. They should be able to sense that you are trying your best to help the patient. Yes, Dr. Matani, you wish to say something. Go ahead, please.
Yeah. Ma'am, see, talking about this listening and empathy with the patients, I mean, I pride myself on, that I really do, try to communicate my best.
Yeah.
But I think last time also I, said this, there are good days and bad days. And sometimes you do find, patients repeating over and over again. And, at that time, sometimes, we are also human, and you just, not that we lose our temper, but then, we become indifferent. So any kind of, you might have some tips or something that how not to get into this. And we have these preformed notions when that patient will come for a follow-up. Oh, now again, she's going to come and, start, going on and on. So
Same
any tips?
Yeah. So one is, as I said last time also, have people in your team who can do the listening part for you. That's one thing. Because if they need to be heard, maybe there is some important information in that listening that can help you in the treatment. So somebody has to hear her story. Maybe there is something that is related with the treatment or outcome or recovery or follow-up. So that information has to be obtained. If you don't have time, have people who can obtain that information. That is one thing. So patients would go haywire. They would talk about things that are not related with the present illness, especially elderly patients. And especially in ophthalmology, we have a lot of elderly patients coming, and they'll talk about a lot of things that are not related with the present condition. Now, when I ask, doctors in the government setup, how do you stop the patient who is talking things that are not related? A lot of them say, "Ma'am, हम तो मुंह पे बोल देते हैं, ज़्यादा कहानीबाजी मत करिए." Deepika, for you, I'm repeating in English. I know you said you sometimes don't understand. So when I ask these doctors in government setup, like if patients talk things that are not related with the present condition, how do you handle that situation? A lot of them say, please shut up. Don't talk unnecessary things. We are not here to listen to your bullshit. I mean, they've said this directly to me. Sometimes they even use further foul language with the patient. But if people working in corporate setup, I'm sure Dr. Sudarshan, Dr. Rajesh, Dr. Janvi will agree with me. They will verbally not say anything like this because they can't say like this to their patient. But through their body language, they communicate, I'm not listening to you. Listen, mind your business, mind your tongue. Both are unhealthy. If patient is talking something that's not related to the problem, I can say, I understand you have a lot to talk, but I have a lot of patience to see. Can you tell me what is the reason of your visit today? I think I'll be able to help you better. What I'm trying to say, if you assert in the right way, right language, right tone of voice, and right body language. I'll speak in Hindi for Ravi to. बाबा जी, मुझे पता है आप बहुत सारी बातें मेरे साथ करना चाह रही हैं, मेरा भी मन कर रहा है आपसे बहुत सारी बात करने का, पर बहुत सारे पेशेंट हैं. अगर मुझे ये बताएंगे कि आप मेरे पास किस लिए आए हैं, तो मैं आपकी ज्यादा अच्छे से हेल्प कर पाऊँ. You know what happens when we are rude with the patient, especially with the elderly patient? You will see there will always be a attendant with this patient, either the son or daughter or grandson, granddaughter. When you talk in a wrong manner or in a wrong gesture, more than the patient, it is the family member who really feels very bad because we have ill-treated or disrespected the patient. They will have it here. They'll take it with a pinch of salt. But given a chance, they will give us back with interest. The aggressive reactions we receive from them is not because of that one small incident. It's a cumulative anger that they carry in their heart. And the moment they get a chance, they burst out. So we got to be careful. It's not now just for the patient satisfaction, for our own safety also. We got to treat patients with respect. We are charging them. They are paying us. When you go for a cup of coffee and the coffee is not of your taste, if it is cold, it is not tasty, it is stale, you don't pay. Rather, you shout at them and you say, what is this? I've paid you 200 rupees for this coffee and you're serving me this nonsense. And they come and apologize, and they sometimes even waive off the bill and they serve you a second cup of coffee. This is what your clients want. You like it or not. If you were giving it free, you could behave the way you want. You are charging, you have to give value for money. If you don't change, you have to face the consequences. Choice is yours. I hope that helps you.
Ma'am, may I add over here something?
Sure.
Since we are discussing about sympathy and empathy, would it mean that way that sympathy is something more external? Like, for example, we see some person who's invalid and we feel pity, okay? Oh, how sad, and on, more external. And empathy, according to me, is something that is much deeper, I feel, internal. When you have that ability to actually understand and, sense and connect with that other person, what that other person is going through. I mean, am I right? I don't know whether I'm right.
Absolutely. And then the second step is, what can I do to reduce this suffering? That's the real application of empathy. I will never lose the sight of my patient's welfare. I will always remember, this has to be done, this needs to be done, this is what I'm supposed to be doing, and I shall do too.
I think that would be
the misbehaved or not, in the right senses, I will not lose sight of my patient.
And people who are empathetic would be able to deal with such situations in a better way.
But then once you will start practicing empathy, you will actually start feeling light, because you will see immediate result of your, change to be. Thank you. So moving forward quickly to the next topic, and the next topic is designing a successful program. So for some of you, you may think, I am not into training. Why do I need to understand how do you go about designing a program? Some of you may be thinking, after learning this program, after doing this program, I'm going to design my own program. So definitely you will find this topic very useful. But at the same time, even if you are not going to, conduct any formal training program, you may need to train your own staff. You may even need to deliver a program in a CME or your conferences, professional conferences. So there will be a lot of opportunities where you will need to speak. So this session will help you how you can make sure that what you say is well designed, well planned, and actually it really gets the recognition or acknowledgement or appreciation for what you have done. So if I may ask you, how many of you are actually into designing a program? Please raise your hand so that I have an idea. Okay, I can see 3 hands. What about others? You are not. 4. I can see 4 hands. Rest are not in designing programs. Okay, yeah, I can see 4, 5 hands. Yes, 5 hands I can see.
So I used to design programs while I was a teacher in the college. Now but very interesting topic, ma'am.
Absolutely, absolutely. So like Janvi also says, not formal program, but then definitely when you have to impart some knowledge, some skills, some awareness, that's nothing but actually a loosely planned a program. But then that's also a part of program. Yes, Dr. Farah also says, I sometimes, do arrange. Definitely, I think that means somewhere we all require an understanding, how do you go about, and if not today, maybe tomorrow you will be engaged somewhere as a trainer. So you should know what is the right recipe for designing a successful program. So normally, what challenges do you think we experience when it comes to designing a program? Or when you deliver a talk, for example, forget about designing a program. If you have to, even deliver a talk, 10 minutes, 15 minutes, 30 minutes, what are the common challenges we normally experience?
It is about sorry.
Yeah.
Is it about a talk you're saying, Dr. Indu?
It could be talk or session. Like I can see an answer coming from Shivraj. He says, understanding the expectations of audience. Very right. A lot of time you go with the program and you have delivered your best, but it does not go with the expectations of the audience, and there's a mismatch.
Right.
That means, do I really know what is my patient's expectation?
Yeah. Also,
Or
who is there in the audience?
yes, who is there in the
Yeah.
audience? A lot of time, if you don't know your audience, you may prepare something, but that may not fit your audience at all. So if you remember, I sent you that questionnaire, brief introduction of the participant. Every time before I do a program, I always send that questionnaire so that I have an idea who is my audience, what are their expectations, what are their training needs. Like Dr. Deepika has written, to convey the content within the stipulated time. Yes, time is also a factor. A lot of time our program actually goes haywire just because we don't keep an eye on the time, and we miss the major content just because we have not been. Okay, how to keep the audience engaged? Yes, I think that's one of the biggest challenge. Everybody has content, but we don't know how do you really, especially when you are dealing with educated professionals. Kids, you can engage, but youngsters, it's a very challenging thing to engage them. Adults, educated adults, professionals, if you have no content, no pedagogy, you are going to be, in a very difficult situation. Then making schedule for all. Yes, how do you really schedule the training program? How not to make it monotonous and engage interest of audience. I think the same thing what Janvi has said. Then audience centric. How do I make my program audience centric? Know your audience is important. Content of the program. Yes, sometimes we don't know how do you really organize your content in a manner that it flows. It flows like a story. And then we do not know the audience requirement. Absolutely. That's also one of the, and also if you're doing it for management has some other training need. The audience has some other training need. There's a mismatch, even that can be an issue. Then connect from one topic to another. So how do you move? How do you, really in a flow manner, how do you take the audience from one topic to another? Then right objectives, right content, right audience. Sometimes it's difficult to know. How to implant the point and make them experience. Yes, that means how do I really communicate a message in a manner that it gets actually clearly, dot on in the person's head or heart. And then mode of training, PPT or other. Yes, I think often it is PPT. So, and now we know PPT nobody likes. Nobody likes PPT. So how do I make it, more interesting and engaging? So to be able to answer the questions, yes, that's an important thing. That means I really need to be ready with a lot of content because I don't know what my audience might ask. So I should really have, the answers ready. And then KAP gaps, not assessment. Yes, absolutely. Simplicity is one issue. Then powerful content, selection, and cohesiveness. Absolutely. So that means if we attend today's session and the next session, these two sessions I had kept in mind because I want to send you with, with the ability to not only design your program successfully, but also deliver it in the best possible manner. Yes, experiential methodologies, I agree. And Shivraj says, presenting self to the audience convincingly. Yes, absolutely. I agree with you. So that means,
ma'am, I had mentioned technical lacunae because, many times when we are making a PPT and sometimes, there is some technical problem and then you cannot just wait till that thing gets sorted out. So you have
absolutely.
to be prepared with, what next, how you fill that gap and
you go with the PPT. You go with the PPT and there is no electricity.
And there is no electric, there is power failure. So that's a huge thing. I mean,
and if you don't have a backup plan,
everything goes haywire.
You're gone. Absolutely. So today's session, I think, will give you a lot of food for thought. And I'm going to discuss kind of structure that will help you in knowing the steps that will give you a definite idea how can I design a successful program. Next session will be on the facilitation skills, where I will be talking about different pedagogies and how do you make sure that your program is interesting, engaging, and also you get, good reviews from your audience. So these two sessions I've kept particularly for these two topics. So I'm going to share the screen to discuss some of these steps that will really help you understanding. 1 second, yeah. Okay, there we go. Okay. So if I talk about the steps to designing a training program, as a lot of you said, that sometimes we don't know the expectation, sometimes we don't know the training objective. First and foremost thing that comes to my mind when I think of a training program is find out their training needs. By the way, how do you all find out the training needs of your audience? How do you normally find out the training needs of your audience?
Ma'am, in like, I can take an example of my own organization. With the training needs for entry level, say it has already been pre-decided by the organization itself. That if these sort of doctors have to be, or young and medical officers have to be recruited, these would be the basic parameters in which they should be trained. First comes from
That's more
the
like an induction program. That's more like an induction program, which is perfectly all right. So when you have a pre-designed induction program, thinking that these are the things we need to really, tell to our new joinee, which is all right. But when it is on the job training, normally how do you, assess the training needs? What are the different ways that we use?
Ma'am, I to analyze the incidence reports, which include the non-conformities, the negative feedback, the complaints. They understand that this area is weakness, so we to arrange the training for that particular area.
Very good. What are the other ways, if others can think and answer?
We can have like a pre-training questionnaire or like a feedback or a survey, which be able to check whether somebody is aware of any particular information that we want to check, or what are the points in those.
So actually, if you could do a training need analysis, in corporate, they do it in a very structured manner. They have set questionnaires ready where they actually do the knowledge assessment or skill assessment. In healthcare, still we do not have a lot of well structured training need analysis tools, but then there are a lot of other ways. For example, on-site observation. So if you will observe your staff interacting, or you will see your staff doing a procedure, you will have an idea, okay, this person does not know hospital infection control methods, so you need to talk about it. Or if you send a mystery customer, you will get to know how my staff is interacting with the patient. You could even ask the audience, what do you think you want to work on? So if you remember, in all my feedback form, there's a question, what more topics do you want me to cover, or what specific topic do you want me to cover? So that gives me an idea that you are voluntarily attending the program, and whatever topics that you will make a mention, although sometimes actually they are out of the scope of the program, because we have tailored this program for the communication program. A lot of your requirements are related to the management. So, but we try to touch upon them. So there are different ways. For example, you said taking patients' feedback or incident report or complaints and suggestions. That will give you a lot of idea about what are the training needs of the team. So once you have actually, found out the training needs, it's important to develop the training objectives based on the training needs and the expectations of the organization. So whatever you think you want to make sure to give to your audience, and whatever the training needs you have identified, if you club both of them on the basis, then you can develop your training objectives. So training objective could be creating awareness, or it could be sensitizing. It could be in imparting new skill and knowledge. It could be to bring change in the attitude. It could be the promotion and growth of your team that you want them to really, or align them to the vision and mission of the organization. Sometimes their actions are not in alignment with the mission and vision of the organization. Skill building is another reason. Behavior modification could be another, training, objective. So once you have identified these objectives, based on that, we are going to actually now think what you want to talk about. So those of you who are seasoned trainers or seasoned administrator, actually you have an idea, these are the things that I need to talk to my audience. But a lot of time, many of us have no idea what we need to talk under this topic. So for that, you will have to do little research. If you go on Google search, put that topic, you will get a lot of information. Okay, this can be talked, this can be discussed, this can be brought in this. So make a bucket list of topics. I use this tool called eDraw Master, eDraw Mind Master. Actually, you can note down this. Let me see if I can show you one of my 1 second. Let me see if I can see. Yeah, give me 1 second. You can see my screen, I think. Okay, so I'm showing you you can note down this eDraw Mind Master. This is a free tool available on Play Store or App Store, and you can download this. There are both the versions available. These are all pro versions, paid version, but I don't use paid version. I use a very basic one, and let me show you one of them. So for example, this is the program I recently did for AIMS Jammu. Now, what I do in this, 1 second, let me make it slightly bigger. So that, is it visible to all? Are you able to read? Somebody please respond.
Yes, ma'am.
Yes.
Madam, a little bit.
थोड़ा और बड़ा करूं? Then should I increase the size? Okay. Is it visible now?
Yes,
okay.
ma'am.
Okay. So what I do, I will actually write the main topic in the center. This is my main topic. So the topic was essential interpersonal skills while interacting with teachers and fellow students. This was the program for students in this. So what I would do, I will have lot of ideas coming to my mind. So what I will click on this floating topic, pick this and write whatever comes to my mind. I will write into this and I will leave it. That way I will have around 10, 15, 20, 30 ideas coming to my mind, and I can just put them as a floating topic. Then from there, I will actually organize them in this manner, what should go first and what should go later. Give me 1 second to stop this so that I can. Okay. So create a bucket list of topics. I use this tool, eDraw Mind Master. You may have your own tool, or you can just note down in your notebook whatever thoughts that occur to you that you think will help you designing your program. You can note them down. After you have it will be in a random order, because the ideas are not going to come in a organized manner. It will be most likely in a random manner. Once you have all the idea, now create a flow in the content. This is step 4. Step 1 was training need. Step 2 was, no, what was the first one? What was the first one?
Training need.
Training need. Then based on that, the training objectives. And then third one was creating the bucket list of topics. Step 4 is now create a flow in the content. Now from that content, you will have to choose what will go in the beginning. Then what will be the body? How are you going to end it? And what is going to be the takeaway? So you have to create a flow in the content. So those points that you have written in the bucket list, you will actually have to take up and down to see how that fit into the body, beginning or the end of the content. Step 5, which is very important, is now develop your training pedagogies. I think that's very important. Most of us are in habit of using PPT, which is okay, but that's not sufficient. Especially when you will work with your audience, you will see people prefer activities and many other things than actually just the PPT. So right now, what different pedagogies are you using in your training program? You can write in the chat box. What different pedagogies are you using right now? Adult learning, okay. Experiential learning, role play, PPT mainly, PPT, show visual, then again PPT, simulation. Yes, I understand because you're into simulation. That must be really helping you. So you can see there are so many pedagogies available. Very honestly, PPT is just now one of them. You could use role plays, you could use questionnaires, you could use your, one second, yeah, experience sharing, storytelling, and rapid fire round, puzzle, group activities, videos, and whatnot. So you can see there are so many options available. And actually, if you really want to make sure, gaming, yes, that's also one. Kahoot people use as a polling, tool to get everybody's idea. Case studies, yes, Dr. Kapoor, I completely agree. Case studies normally is a good idea to use where you have very mature audience and who are going to be with you in a program on long-term basis. Then it's a wonderful tool, and most of the management school use case studies as a way of working with the adult educated professionals. So interactive discussion, yes, Bhara, I agree with you. Problem-based case discussion, yes, that's also a good thing, where you have a small situation where within half an hour to 45 minutes or 1 hour we are going to work on this case and come up with these discussion around it. That's also a good idea. So it could be anything. It could be anything, but you must have a list of training pedagogies or the ideas on your mind. It could be about how do you begin, then how do you explain a concept, or how do you really introduce an idea. So you should have a bucket of these training pedagogies. Now integrate these interesting and engaging activities with the flow of your content. Now, something you might find very interesting to start with. So maybe you may start a session with the video. Yes, combination, storytelling, case study, and bilateral discussion. Absolutely. Again, a very, again, integrating a lot of things you're saying. Or maybe you could show a video and have a discussion around the video. Maybe like today we did an activity of Chinese whisper, and you got to know an idea about how, though we say we listen very effectively, but how things get haywire when we don't listen. Any online tools about what, Padma? Which online tool are you talking about, Padma? You can unmute and speak.
Now after pandemic, most of the sessions are hybrid. Yeah. Sometimes we have to deliver online sessions also.
Yeah.
When we are conducting online sessions, any tools we can use for interacting with them, for engaging with the audience?
So I would say you will have to be really innovative in modifying your activities so that you can use them on, like for example, this Chinese whisper I used to always do in a classroom setup, where I will send some of the participants outside, and then I will make them, come one by one and repeat whatever they have heard. But I know I can't send you anywhere, so I put people in the waiting area, and then I brought them in. So that's how you will have to very innovatively use different pedagogies. Mentimeter, I've heard of this Mentimeter. Can you explain, Dr. Vaibhavi?
I have used Mentimeter during COVID times quite a lot because we had to educate online.
Mm-hmm.
It is like an app which we can download.
Okay.
And at the same time, it can be used like a web-based PPT, PowerPoint.
Okay.
It can be used as a web-based PowerPoint, but it is actually has to be integrated with Zoom, or it has to be used through PowerPoint. Mm-hmm. And what it does is the best part about it is the screen that is seen here. Like I'm using Mentimeter as a PowerPoint slide, for example. Mm-hmm. Then I share a QR code with all the participants who are there.
Okay.
Through this QR code, they can actually go to a site called menti.com, mm-hmm. participants, and they can write the answers. Those mm-hmm. all answers will come on the slide. So it is like...
So hold on. So after the next session, rather at the end of the next session, session 4, I'm going to share a list of different pedagogies where each one of you will be choosing one pedagogy and you will be making a 10 minutes presentation on that pedagogy. So I would request Dr. Vaibhavi to introduce all of us to Mentimeter.
Done.
So
yes.
I'll share the list and I have not added, but that's an interesting thing that I'm learning from you.
Sure.
So I'll put that as one of the options. You can choose this option and then you make a presentation on this.
Done.
It's going to be a real good learning for all of us. Let me stop sharing and just connect with all of you. After the next session, after session 4, we all will be choosing one of the pedagogies from the list. You can even suggest me something that is not in the list, but you think it's very interesting and it is very useful, or if you're using something very different. So each one of you will have to make a 10 minutes presentation. In that, 2-3 things are very important. Time is very important. If I say 10 minutes, please finish it in 9 minutes and 30 seconds. That means that's it, time limit. Second is, before you will make the presentation, you will have to discuss with me, show me your presentation and discuss how you're going to deliver it. And what needs to be done, I will be explaining in the next session. But then that way you can well imagine, if each one of us makes one presentation, how many new pedagogies are you going to learn through this? So from session 5 onwards, we are going to go up to session 10 and have 3 presentations every time. So there will be 15 new pedagogies we will be, and it will be a very big learning for all of us. So thank you. Yes, Padma, go ahead. Yeah.
I have heard that there are many online tools to engage our audience, not only Mentimeter, some other tools like
Kahoot. Somebody was saying Kahoot. Last time somebody talked about Kahoot. Again, it's on polling. Yeah.
I heard, I have attended very long back a session, online facilitation skills.
Okay.
That time I have noted down, but unfortunately I lost my laptop, my notebook, everything in the journey.
Okay.
So I lost it. So not only Mentimeter, We'll Decide. One is We'll Decide. Another one is breakout rooms. Anyway, now
everyone breakout rooms very common. Yeah,
common. And quizzes.
So Padma, I will ask you to do little more research, and it will be really wonderful for everybody to learn. Like Dr. Webby is going to talk about Mentimeter. You can pick up any other tool that you are familiar with, or you can search and
I'll just search and
wonderful. That will be really wonderful. Very nice. Thank you so much. So as I was saying, that you will learn a lot of pedagogies, and also you already may be using them. Now is the time to integrate these activities with the flow of your content. So then you will know how I'm going to start, where I'm going to use what activity. For example, I use the video to talk about verbal and non-verbal component. So my videos did a great job in making all of you understand that this is how we normally talk, and see the kind of errors we all do. Similarly, somewhere we have used questionnaire, somewhere we are going to use puzzle. In coming sessions, I'm going to use rapid fire session with you. So all that will give you new ideas about how to go about, designing a program. Once you have created a structure, you have pedagogies placed, what you're going to use where. I will always have a list of pedagogies. See, for example, even if I've done this program hundreds times, I will still know these activities I need to do and integrate at the right place at the right time. Similarly, when you will do it on regular basis, you will slowly learn the right way of doing it. After that, develop your course material. It could be a handout or it could be a handbook, depending upon the size of your program, which is all right. If it is just 1 hour, 2 hour sensitization session, maybe you can give them a handout. If you think it's a long program, you're going to spread it over 1 year, then have a proper handbook so that it stays with them and they can refer it as and when they can do it. Once you have done it, then the next step, that is step 8, is to develop questionnaire on the post-test, pre-test, and feedback. You should always have a pre-test and a post-test and feedback, because that will give you an idea where you were and where you have been able to bring them. That shows a tangible change in their knowledge, at least, if not in the skill or behavior. So you should always, have a pre-test, post-test, and feedback. Feedback form should always be as simple as possible. Don't make it too complex. People would not take out time to write stories. It's better if you have mostly MCQs and easy to kind of a tick kind of a thing. But it should be, to the point and simple. So don't forget to take feedback from the participants I think we missed one slide, and that is executing the training. Yeah. So after you have developed everything, execute your training and then take feedback from the participants. Once you have taken feedback, now you have an idea what do people feel about my program. It's time to sit and reflect. Take your audience's feedback very, very seriously. Read everybody's comment. Something relevant might come up, something useful might come up, which you can integrate in your future program and see how you can make them better. Even a simple question like which methodology or pedagogy you like the most out of all. If role play video, you will get to see a lot of people like role plays, and that makes your task so easy, because through role plays it's easy to train people, and it doesn't require PPT or anything. You can actually make them do something and let them learn. So sit and reflect. The more you will reflect, more effective you will become in your training program. Now, some of the things that will help you designing your program in a successful program. One is the mode of training that you should keep in mind. If it is online or if it is offsite. So if you know the mode of training, then accordingly you will have to plan what is going to work. Like for example, Padma says in the online mode we require more online tools that can help us engage our audience. Whereas in the on-site training or in-house training, you will actually be able to use a lot of action, moving around, a lot of those activities you will be able to move. So it's very important to know what is the mode of training. Second thing that I would advise you to know about your audience is what is the audience size. So in online session, it's always advisable to keep size not more than 25, because on a screen, you cannot see more than 25 people. And if you have more audience, then you will have to actually every time move your screen, which is very, distracting. Similarly, on an on-site program, it's again a good idea to keep this audience size to 25 to 30, because if you want to engage them, if you want to make them do something like role plays or some action or group activities, if you have a very large audience, it cannot be a workshop. Then it will be more like lecture session. For example, this is recently I was invited at Rajiv Gandhi Cancer Institute. So they said there will be around 25, 30 people. But imagine the number of people who were there in the program. It's I think more than 100 people sitting. So it ultimately turned out to be more like a seminar kind of a thing. Similarly, a lot of time you go with the idea that there will be 20, 25 people and you see only 2 or 3 or 5 people. This has happened with me. Like I deliver sessions for Delhi Judicial Academy. So mostly it is for the newly inducted judges for whom they invite me for speaking to them. So this time they said, ma'am, we want to talk about the stress management part for the Delhi judicial officers. I said, okay, wonderful. And when I went on online, there were only 3 participants. 3 or 5, yeah. I asked about what happened. They said, ma'am, these are the people who are actually going to be appointed for a particular job. So we were doing an induction program, and this is this size. Wow. You have a cat? Wow. So mentally also you need to be ready for a situation where there can be a more or less number than what you were thinking. But it's always good to check the audience size. Ask your organizer, what is the audience size? Optimum size, I would say not more than 25 to 30, whether online or on-site program. Again, it's good to know who is your audience. Are they young adults? Are they senior people? Are they doctors? Are they nurses? Are they technical staff? You must always ask this question to your organizer. If you're in your own organization doing training program, you will know whom you're calling as an audience. But suppose if you're invited by another organization, I always ask them to send me an Excel sheet of people who are going to attend the program. So you will clearly know what is their designation, age, experience, qualification, even sometimes how many years of experience they have in training or overall in that subject. So it's helpful to know the detail of your audience. Then, if I may ask you, this is one question that always troubles me. How do you find out how willing is the audience? And can you really find out?
I guess based on the expectations sent to them previous to the workshop, they write their expectations, and I think from that a little bit judgment of.
So I did around 500 programs in Delhi Government Hospital. Dr. Kapoor knows, because in those days I used to go to his hospital also to do the program. And every time I went there, there was a different set of audience. And most of them were not very willing to attend the program because they were asked by their management to come and attend the program. So the biggest challenge there will be actually to first of all create interest. Yes, Padma, I agree. Many of them are not willing to attend. And then Shivra says very difficult to analyze for a large group. Yes, and I can see in their eyes and face. I agree. And when you look into their eyes and when you see disinterest, it can actually demotivate you. So one of the good ways to avoid that situation is don't make eye contact when you're looking at your audience. Always look above the eyes. Because if you will look at the eyes and if you see them disinterested, that's going to upset you. Of course, in the next session, we are going to talk about difficult audience. We are going to talk at length and how do you handle difficult audience. I'll be sharing some of my failure experiences and then how I learned from them and what I did to turn the tables. I'll be sharing in the next session. But yes, it's a very important part. A lot of time you will get audience who is not willing. A lot of time, even if they're paid for the program, you will see they will have some other priority on their mind and they will not, be willing to attend or participate. So that means your program has to be really very engaging and engrossing to get them, unhooked from that activity and then get engaged with you. Of course, we'll be talking in detail about in the next session that how do you go about doing it. And then very important thing that is, to remember, like one of you said, how do you manage time? And it's very important to know how much time do I have? How much time do I have? So I remember when initially people used to call me for any, to speak in the conference, they'll say 8 minutes, 12 minutes. So for me, it was like, how can anybody talk in 8 minutes and 12 minutes? But then slowly I realized I can't keep refusing that it's not possible to cover this topic in 8 and 10 minutes. Then I worked on myself, then I worked on my strategy. I worked on my strategy and then I learned that you can actually deliver in whatever time you're given if you know how to deliver that. Yeah. So the benefit of that learning, of course, it comes with a lot of time, a lot of practice, because it's not easy to time your, even today, like when I'm talking to you, I have a watch right in front of my eyes, right in front of, and I keep looking at the watch. And I know, because see, as a speaker, you may have lot of content, lot of material to give. But if it goes beyond time, it becomes useless. Audience gets disinterested. So if you can finish within time, you can keep your audience engaged. Even the audience will be happy to stick with you. If you say 3 to 5, I'll be having a training. And 5 minutes to 5, if you end the session, they are happy. But if you go 5 minutes beyond 5, you will see them looking at their watch. It's a waste of complete, effort. So try to keep your, time within allotted time and finish it. Even till date, I'm practicing and working on it. And I would advise everybody to really, really work on the timing, and then that will give you a lot of confidence also that I finish my content in that. Now coming to the next thing, which is important before you actually deliver a program, that's about the project for the resources. Just 1 second, the slide is not moving. Yeah, resources. So resources, like it's important to find out beforehand about the availability of projector, mic, audio system for video projection. So for me, when I had to show videos to various hospitals, I think 35 hospitals of Delhi, I must have visited more than 20 times each hospital. A lot of them did not have mic. So I had to literally raise my voice by turning my ear. Now the problem is I have actually started speaking louder. My children say, Mom, you're always in your classroom, because I've developed that habit of, raising my voice without mic. So you really need to, make sure that you have that available. Sometimes when you want to show videos, they will not have system to project video. So I used to carry a small, mic with me, because I could see that a lot of hospitals did not have enough audio system. So you'll have to see how you can, having a wall clock facing you is a good idea, so that you can keep an eye on the time and manage your content accordingly. Having name tags for the audience, ask them to write in their first name in capital, because when you have their names visible to you and you call them by name, trust me, they get connected with you and they know you can read their name. So ask them to have a name tag pinned to their left or right shoulder. It's a good idea to connect with them. Of course, you will require a set of stationery. Make sure that they arrange for that stationery for the audience. Then for activities, you will require props. Of course, you will have to either carry or let them know that I will be needing these activities. So I will be doing some activities and you need to bring these items or props. So basic things like water, tea, coffee, this is all part of resources. If you can discuss about all this with your audience, with your organizers, I think it will give you a better control on this situation. Now, coming to some of the very small but very important tips that will help you to design your program in a more successful and effective manner. Integrate what is in it for me to engage your audience. If you can write from the beginning, like for example, if you saw every time I introduce a topic, I am aware of the fact that some of you are not into training. So some of you might think, why am I attending this program? I immediately help you see if you're attending this session, this is going to help you not just to organize a training program, even if you have to speak in conference or in any meeting, this will help you to design your talk. Immediately you will get connected. So please remember to make sure that you are able to bring in this, what is in it for me. Only if they find it useful and interesting, they would like to attend your session. Then make sure beginning and the end of your session is very engaging, because we all know well begun is half done and all is well that ends well. So make sure that of course, the body has to be good, but then your beginning is done very well, because the moment you have been able to engage your audience, it becomes easy to sustain their attention. And similarly, if you are able to bring them to an interesting end, to some good takeaway, they will be happy about the program. We have a tendency to give a lot of information. Change this style. Develop habit of asking questions to your audience. So like I'm asking you questions and the answers I'm getting from you are really very enlightening, really very interesting. And I also get to see, okay, they are already thinking on these lines. They have these things on their mind, or these are their concerns. And when you make them speak, a lot of time, the information that you get, it automatically, does a lot of your job. And you don't have to speak that much or deliver that much of information. Experience has long lasting impact. For example, if I had talked about information getting distorted in a theoretical manner, a lot of information gets lost. People don't communicate well. They will add something, they will minus something, they will not give the correct information. Now, instead of this, when I made you do this activity on Chinese whisper, I think all your life you will remember. Or for example, actions speak louder than words. If I had taught you this in a verbal manner, and then when I made you do this activity, when you're happy and that you remember, okay, we followed her action. So creating these kind of, wow experience is very helpful, because that's where they will remember. So content has very limited value. It's the experience that goes a long way. So make sure that your program has good, experience opportunities. Just to add here, see, when you make people just read the PPT, then just small portion of the brain is engaged. When they are listening to you, another small portion of their brain is engaged. But when you ask them to participate, when you engage them into activity, you can see a large portion of the brain actually gets engaged. So when you are developing your training curriculum and pedagogies, make sure that you are able to engage larger portion of your brain, So automatically their attention will be towards the session. When you are speaking to a very learned audience, very knowledgeable audience, make sure that you support your opinion and statements with studies and reports. I never valued this much, but I realized when I integrated this in my session, people were very happy that, okay, what she's saying is not out of her experience or of her understanding, but there are studies that support what she's saying. So make sure that you support your opinion with the studies and reports from the various platforms. Again, a very important thing, keep updating your knowledge and skill. We all know every day things are changing. Every day new ideas, new thought processes, new theories, new pedagogies are coming up. Keep yourself updated. A lot of time you may you may be asked something that is not related directly to the topic, but your audience wants to know how knowledgeable you are, how thorough you are with your topic and your understanding. So these are a couple of books. They are really, really helpful. This is a book on checklist manifesto by Afrika Wande. I know some of you must have already read it. He's a neurosurgeon, born to NRI parents, and he's in Harvard, and he's written a lot of beautiful books for medical professionals. One must read. Atomic Habit is another interesting book that will help you work on yourself. Leadership levels, complications. I'm just giving you an example. You can choose your own book. And when you will read those books, you'll feel like sharing that knowledge with your audience. Automatically, your program will become more interesting, more engaging. Theory, nobody wants to listen. They want to listen to these stories. Regularly, time your session, because I know this is one of the biggest bottleneck in delivery. Keep checking, where are you going wrong? Where is your, like what you're speaking more or speaking less. So be realistic about how much you can cover, especially if you're very knowledgeable, you're very thorough with your subject. You can go on and on and on. But then there's a limit to how much one can listen. So time your session and see if you are going beyond a point, work on your timing. Regularly reflect on your performance. Even if you have done a program 100 times, there's always something new and interesting to learn or add. Reflect on your performance, see something is not working, take it out, add something that's going to engage and make you feel happy and make your audience feel happy. Practice, practice, practice. There is no substitute. Have you heard of the concept of 10,000 words? Anybody has heard of the concept of 10,000 words? Anybody? So there's a saying, if you invest 10,000 hours into anything, you can be a master of it. You spend 10,000 hours into anything, you can be. You want to say something? Padma, mute your device. Thank you. That's okay. That's okay. Thank you. So 10,000 hours means 8 hours every day, 5 days a week, 44 weeks in a year. That means 5.5 years. And you will be master of anything, whatever you are doing. Similarly, when you will start delivering your programs on healthcare communication or anything, quality implementation, management tools, anything, slowly you will pick up. And all what we are talking can be integrated to whatever you are doing. So this is in a nutshell about how do you go about designing a program. Questions? We have 3 minutes time. Yes, Padma, go ahead.
Ma'am, generally I have done soft skill trainings, no? So most of the trainings are full day sessions. How would be the healthcare sessions? It's a half day or hourly base or full day workshops or like?
So it depends. A lot of organizations may say, come and speak for 1 hour, especially when they have a session for consultants. They would not want a very long session because they know it's very difficult to pull out consultants from their workplace, and also they will not be very interested to sit and listen. But a lot of times they will say in 2 hours, if you can sensitize my staff. Then there are organizations who ask for full day session or sometimes even 2 days session. But it varies depending upon what is their training objective. Sometimes it's just for the sake of NABH. So they'll say, do a 2 hours program, but we'll give you different set of audience, nurses, residents, technicians, front desk staff. So they may ask you 2 days program, but different set of audience. And then you will have to customize your training depending upon their requirement.
Healthcare communication means we have to customize based on the audience. Like doctors, we have to deliver in different way, and the staff and other employees who are involving in the healthcare industry.
See, one is pedagogies can be as engaging as possible. Doesn't make a difference who is the audience, because ultimately you want to engage them, involve them. So learn as many pedagogies, try to integrate as many pedagogies as possible. Keep it as simple as possible, especially for the staff who are not very familiar with the training pedagogy. So for example, I'm doing it for security staff. So I can't be using an online Google form or a questionnaire. I know they will not be able to manage. So I'll rather focus on maybe interactive discussion, role play, and video. So I know videos they can understand, role play they can do, and then discussion around. So I will not engage them into, even PPT may not work here, because PPT will mostly be in English. Many of them may not understand. So it's better to keep it as simple as possible. Even with doctors, more you will engage them in the activity, they will open up. They will be ready to participate. If you are just showing them PPT and talking, most of them will go back to their phone and they'll start doing something. So that's not a good idea.
Once I was asked for deliver 2 days session. They have given certain topics, but the participants are HOD of all departments of the hospital. It was a big brand of Seven Hills Hospital. So I was not certified at that time. So I don't know what to speak for the staff. When the person said that HODs will attend your session and they will train it, it's like a train the trainer program. They will train their department people. Only HODs will attend your program. Like that he said. Train the trainer program is completely different, and they're asking the topics are completely different. So I said it's not possible for me to deliver that session. I have rejected that.
So Padma, you will attend these sessions now. We are on session 3 right now. We have not yet actually started talking about any topic related to healthcare. The first 2 topics are very general, and these 2 topics are going to be about the training pedagogy. Once you will attend those sessions, you will actually know what all topics I can cover in those 2 days. In 2 days time, you can comfortably cover 7 to 8 topics. And all those topics we are going to cover in this session. So I think you will be better equipped for future opportunities. Thank you. Any other question from?
No question. I have something to add. At the ending time, could you please summarize the learning outcome of the total session, if possible, in few terms, few lines after every session?
Okay. So, for example, for today's session, if you ask me about the designing the program, is that you want me to summarize?
Learning outcome.
Learning outcome. So I think learning outcome should come from your side, because I want to know what have you been able to, take, what has been your takeaway, rather than me saying that this should be your learning outcome. If you are able to, tell me what has been your takeaway, I think that would be better.
Yeah. In fact, I want to say, if you mention some key points of total session at the ending time, that's what I want.
Summarization, actually, I will be talking about summarization in the next session, that is facilitation skill. So summarization can be done in different ways. One is that I summarize for you. One could be, if I ask, okay, each one of you tell me your takeaway. Even that's one good way of summarization. Another good way could be, okay, tell me what are the steps of organizing a successful program, and you give me those steps. That's also summarization. So there are different ways of summarization. So you decide which one do you want to try today. So maybe if all of you tell me at least one step that you remember from the different steps of organizing a successful program, that will be a wonderful. Step one.
And I think the session you are conducting so far, it could be the model for designing a program, and everything is given there. How to design, how to select content, and how to deliver, how to create, how to engage the audience, and everything is rich in your program. So we can follow that.
Thank you so much. That's the idea. I said right in the beginning, if you saw my message on the email, I said, I'm giving you the content. You will all be practicing the pedagogies. But if you will observe the way I conduct the program, and if you can replicate it, definitely you will be a much better version of what I'm delivering to you. Because you will have my experience and you will have your own experience, and you will learn from so many other, participants. So you can well imagine how effective your training programs will be overall. Yeah. So I'll quickly summarize for you, because you said you want me to summarize it, and that's a good tip that you are giving me. The first one is find out the training needs of your audience. You can ask from the management, you can ask from your audience, but you must know what are the training needs. Based on that, design your training objectives, because if you know what you are going to do, like for example, I decided I want my audience to go back with the idea that I can design my program. Oh, I know the structure of designing a program. So like learning of the outcome you are asking me, that's my learning outcome. If my audience is able to now structure their program, design a program, at least loosely, if not exactly, I'm happy about it. That, and if you have developed favorable attitude about designing a program, even that's my learning outcome. If a lot of you are convinced that, okay, I'm not going to design a program, but it will help me in planning for my conference or for my talk or for my meeting, even that's my learning outcome. So I have kept my learning outcome as very broad, not just to the, program, but in general, if you are equipped with the skills of effective facilitation, I think this program will be successful. So find out the training need, set the training objectives, then have a bucket list of topics that you want to talk. Usually you will be flowing with the thought. So the day I decide, okay, I have to speak in this hospital, I will start having ideas. Okay, I can talk about this, I can talk about this, I can do this activity. What I do, I keep putting on my e-draw mind master. I will always have a whiteboard like this in front of me. Whatever ideas come to me, I keep writing here. So, because you will forget, ideas will come in a second, you will forget within. At times, in the middle of night at 3 o'clock, 4 o'clock, I will have an idea. I will get up and come and write. Because I know this idea, I will not be able to recollect in the morning. Make it a habit to pen down. Once you have done it, sit and then now organize. What will come first, what will come? Reorder it. Create a flow. After you have created a flow, now fit in the pedagogies. यहाँ पे story चलेगी, यहाँ पे movie चलेगी, यहाँ पे discussion चलेगा. So have that. Time it. I also write, see, I have written. Recap 5 minutes, first session 30 minutes, end by 10. Okay, is it visible?
Yeah.
Now, this is like a reminder for me. In spite of the fact that I'm doing everyday program, but I want to make sure that I work on my time. And then prepare handout or handbook that you want to give, pre-test, post-test feedback. Do the program, ask for feedback. Take that feedback seriously. Sit and reflect. Time your activity. So that will give you a structure to go ahead with the program. I hope that helps. And then I've given a lot of tips which you can watch in the video. YouTube link I will be sharing with you. I'm giving you everything. I'm giving you everything. How you use, that's your choice. So I'll be sharing the feedback form in the WhatsApp group. I request all of you to give your feedback. I received only 9 feedbacks last time. I know you all are very busy. Take out time to give feedback. It will improve your program. If there are no more questions, should I close it? Thank you so much. Good night, everybody. Bye-bye. See you next Tuesday. Now, the next, all sessions will be on Tuesdays, 8 to 10. In case if there, as I said, I'm doing program for Maulana Medical College. If it clashes with that, then maybe I'll have to request you to change. Otherwise, I'll stick to Tuesday. Yes, Dr. Vaibhavi, you want to say something? Go ahead, please.
Dr. Indu, I think next entire week I'm traveling out of India for a course. So I will be back. I'll be going this Saturday and coming back next Saturday. So I might miss this, but I will look into the YouTube videos. I don't want to reschedule everyone if Tuesday suits all.
Yeah. Because last time we had a lot of confusion because somebody said Tuesday, somebody said Friday. Then I said, no, whatever we had originally planned, we'll stick. Because I normally keep one day of the week. Everybody then remembers, okay, this day we don't have to give to anybody.
Sure.
So,
okay.
Padma, I'll be sharing the feedback link. Let me share the feedback in the group. I'll share in the group. Otherwise, I'll be holding you for another 10 minutes. I don't want to hold you at 10 o'clock. Thank you so much, everyone. It was wonderful interacting with you all, and the kind of interaction we are having, participation you all are giving. That's really very encouraging, very enjoyable. Thank you so much. Good night. Bye-bye.